scanning the room.
Hi, my name is Kale Evans. I'm an ADN student here at Lowell State College, and today I'll be demonstrating how to give IV push medications and large amount of IV infusion. So to begin here, I'm going to verify my MAR here with my healthcare provider orders here. So I have Ms. Shirley Coast here, date of birth 4/3/87 with an allergy to codeine. That's on my healthcare provider order. And then here on my MAR, I have that matching information, Shirley Coast 4/3/87 with an allergy to codeine. So that all matches out. I have here an order for 0.9% NS IV with 20 ml equivalents of potassium chloride at 125 mL per hour. That matches both of our healthcare provider order. When I was reviewing Shirley's labs earlier today, I saw that her potassium was at 3, which is a little low, so that medication checks out. We should be getting that. I also have an order here for morphine sulfate at 4 milligrams IV push every 2 hours. PRN for pain. I just came out of her room and she was saying that her pain level was at an 8 out of 10, so she should get it. And the last dose was given 2.5 hours ago, so it is time for her to get that medication again. So now that I know what I'm going to be getting, I can enter my med room, perform hand hygiene and glove up, and start pulling my medication. So the first medication I'm going to pull today is the morphine sulfate. I have it at 4 milligrams IV push. And so I'm going to just go ahead and grab this morphine. It's at 10 milligrams per milliliter, so I know through dimensional analysis I'm going to need to get 0.4 mils to get my 4 milligrams. So I'm just going to make sure that this morphine hasn't been tampered with or anything, that it's ready to go, it isn't expired or anything like that. Okay, so this is ready to go. I'm just going to uncap it and go ahead and clean it. Okay, clean for 10-15 seconds, inward to outward motion, and then I'm just going to let that sit there and dry while I prepare my needle. So all these are intact, they're not been messed with or any way, they are not expired, so I'm going to open them up. Just throw that away. And needle out here. Okay, and while that's there, I got that ready. I'm also going to write the medication label here, so I'm going to have my 0.4 milligrams and morphine. And that's the only information that needs to go on that label. Okay, so I'm going to go ahead and pull my 0.4 here. Okay. And take the needle off. Instill that air into the vial. And then pull my medication. Making sure to get all my air bubbles here. And then this medication can go in the medication disposal bin. Cap this. Make sure that my air bubbles are out. Okay. I'm just going to make sure that the 0.4 is there. Okay. And then I also need to dilute this with 1 ml of regular saline. So I just have a saline flush here. I'm just going to uncap that, make sure that it's aspirating so I won't get any air in there. Okay. Just going to take my needle off from the cap. And then I'm going to instill 1 mil, so I should be at 1.4. Make sure to get all the air bubbles. There's 1.4. And then that can be discarded. And I can then dispose of this needle and get this cap ready. So the needle will go into the sharp spin, and then this will just be a protecting cap so that it stays sterile while I take it to the patient's room from the med room. Go ahead and administer my med label that I filled out earlier. And that medication is ready to go. Okay, so now I can then move on to my my saline mixed with potassium chloride. So I'm just going to start off with the sodium NS. So this bag hasn't been tampered with or anything. There's no leak, so I can go ahead and open it. Okay. And toss that. There's no particles in here or anything. It's not dimly or it's not off color or anything like that. So I should be ready to go with that. With that, I also am going to need my IV tubing and a IV tubing label, and I have my labels here for my medication when I get it pulled. So here I have my potassium chloride here, and it is at 2 milliequivalents per milliliter, and through my dimensional analysis I know that I'll need to pull 10 mils out of here. So I can go ahead and prepare my syringe right after I clean the medication container. Okay, while that's drying, I'll finish prepping my syringe here. And go ahead and open this one. Pull my 10 mils. Cap. So that's fully dried now, so now I can instill the air and take out the medication. Invert. Dispose of that, make sure I got all my air bubbles out. I'll just make sure to verify I got my 10 mils here. And clean the hub off of this. Take the needle trap off and make sure to poke this in and instill it straight down, not to poke a hole into the bag. I can dispose of this into the sharps, this into the garbage, and then I can hand mix this by just squeezing, rolling it over, rolling it back and forth. Okay, and then I can put on my medication labels here. And do one last medication check before leaving for the patient's room. So again, I just got my 0.4 mils of morphine mixed with a mil of NS here, and then I also have my 20 mil equivalents of potassium chloride here with my 250 mils of NS. So those are ready. I can take my gloves off and perform hand hygiene before entering the patient's room and providing privacy, knocking, providing privacy. Wash my hands again once I enter the patient's room, and introducing myself. Put on gloves after washing and just have them confirm their name and date of birth for me. So they told me that their name and date of birth, Shirley Coast 4387, and that matches their wristband as well as my MAR here. They also told me that they are allergic to codeine, which is also what's on their wristband and on my MAR, so I know I'm in the right patient's room. So I can then go ahead and explain to them what medications I'll be giving them. So, hi Shirley, I'm just going to be giving you some morphine for that pain ears that you had. You said it was an 8 out of 10, so I was just going to give you that. It's time for you to be able to get that medication. And then I also have here some potassium chloride here that will hang on the IV and it'll just go in through your arm. When we drew your blood this morning, it was at a 3, and that's a little on the low end, so once we finish this, you should be right back where you need to be. Any questions? No? Okay, good. Okay, so now that I am ready, I'll do my last medication check before instilling medication. So again, I have the same patient here, and then my medication here is potassium chloride at 20 mil equivalents in 0.9% saline. That matches my MAR here. I'm going to be doing that at 112 mils per hour, so I can go ahead and set my pump for that so it's ready for me whenever I get that hung. And then I also have my morphine here, which is at 0.4 milligrams with a 1 milliliter of fluid of NS mixed to dilute it, and that matches my MAR. So I can go ahead and start instilling these medications to the patient. So before I do anything, I'm going to make sure that the client's saline lock is unlocked here. I'm going to look for any signs of infiltration in the site here, make sure that there's no pain or redness or anything like that, and then I'm going ahead and clean the site. And then before I do anything, before I ever instill medication, I want to flush it with a saline flush. And then on this first one, I want to be able to pull back and see blood return. That way I know that the blood, or this line is patent, and then I can go ahead and instill the 3 mils of saline. Excuse me. Okay, so once I'm done with that, that can go into the garbage, and then I can get ready to instill my morphine here. Okay, and since this was sterile from the med room, and I cleaned that and that stayed sterile with the sterile saline flush, I don't need to clean the site again. So I can go ahead and connect this. And with morphine, you have to push at a slow rate, so this dose I'll have to push over 2 minutes. But for time's sake of this video, I'm just going to administer it normally. But in real life, I would administer it over 2 minutes. Okay. And then this can go into the garbage as well. And then I'll need to flush it one last time. And same thing, since this is sterile and the morphine was sterile, I can just connect these without having to clean my hub once again. And I'm going to push this last one a little bit slower because there may be some morphine left in the saline lock. So I just need to make sure to just push this one a little slow at the beginning, maybe over a minute, and then I can go ahead and finish the rest of it. Okay, and so once those 3 are instilled, I can lock this back until I'm ready to connect the tubing. So this will be garbage, and now since I've done that, I can clean here. Okay, so now I can get ready to hang my bags here. I've already done my medication checks, and this primary tubing is new and everything. There's no holes in it or anything. And it's not expired, so I can pull it out. Make sure that it is locked. Okay. And now I can pull my port here. Pull my spike port cover. Spike is in. We go ahead and hang it. Unravel this. It is still locked, so there's no flowing just yet. And then once I'm ready for it to flow, I'll open up this end, making sure not to touch anything to keep it sterile. Set that up. Fill my drip chamber, and open up the flow. Make sure that this is all open. And making sure we get all air bubbles out. Now once I'm flowing, I can go ahead and stop this. Put my locks on, put my cover on, and lock on. And hang this so that it stays sterile. And then I can throw in the IV tubing label what time. I put it up what day, and then initial it too. Okay, so that's all done. I'll put that right underneath the drip chamber here. Okay. So now we're ready to install this into the patient. ready. And I'll just clean this one last time for safety measures. Making sure that the saline lock is open. Connected here, we're going to make sure all our locks here are off. That one's off. This one's off. And then this one's off. And then we're going to make sure to set our pump here at 125 mils per hour. And we do have flow coming. Okay. So we're going to make sure that the site's not infiltrated or anything. We're going to make sure the patient's comfortable. If they have any questions for us. And then we're also going to make sure that they have their call button in place, and then we can then exit the room after taking our gloves off, washing our hands in the next room. So time's passed now, the infusion's finished, so I can then go back into the room, knock, provide privacy, wash my hands, glove back up, and then I can make sure that we're ready to disconnect the IV. I'm going to look at the site, make sure there's no sites of infiltrations or anything. Make sure that I have the right patient, so same thing, name and date of birth, ask the patient, they can confirm, I can confirm with my MAR, their wristband, and then their allergies as well. So I can then explain what we're going to be doing. We're just going to be disconnecting this and getting you ready. Okay, so I'm going to wash, glove up, and then I can then go ahead, turn the pump off, make sure that all this has been administered, make sure that we're all good here. Okay, and so I'm going to turn the pump off, lock everything, lock all my locks. Okay. And then I can also disconnect. Okay. Back on this to make sure that this stays sterile, because we may be able to use this tubing after if we need to install another one of these medications. I can then clean the hub one last time before I flush with the saline flush to make sure that all the medication has been instilled. Make sure to unlock this. Instilling saline flush, and then I can relock the saline lock, take this off, and clean one last time for good measure, so that when the next person comes in, they can also clean it. This is just to prevent any other forms of infection. So once I'm finished with that, I can make sure the client's sitting peacefully. They don't need anything from me. Their call light is within reach and their water's filled. I can then take my gloves off and wash my hands, and then I can go back to the nurse station and document everything I've done. So I'm going to document whether I used a pump or gravity tubing, the flow rate, the medication, how much I've administered, the rate. I'm going to look at before, during, and after the administration of the medication for the site to make sure it's not infiltrated or anything like that, and how the patient tolerated the entire procedure.